Hello, I am here with Dr. Willie, my favorite person.
Hi there.
And we are going to be talking about libido in perimenopause. Something we've touched on. I know. You guys are nervous about this a little bit, but I know that a lot of you have questions. We're not only going to talk about libido, we're going to talk about a couple other symptoms and things that I get a lot of DMs about. But if you are new here, my name is Lauren. I'm 44, almost 45 years old. I love teaching easy makeup, midlife tips, talking about everything in midlife. And this is my own personal functional practitioner, Dr. Willie. He has a clinic here in town, so I'm going to let him introduce himself before we get started.
Sure. My name is Warren. I've been in what we now call functional medicine for 30 years.
It's amazing.
Oh my God. Yeah, we call it
That's
anti-aging medicine, regenerative medicine, all these different names. Now it's functional medicine. I don't care what it is. It's treating the whole person.
Yes.
It's looking at more than just a symptom, but trying to find the cause, looking at the whole person.
Yeah.
That's really what it is. And a big part of that are hormones. And a big part of that is SEX.
Yeah, which we're going to talk about today, you guys.
Yes. That's
Hopefully don't get canceled today.
We will keep our... I will promise I will not use language that's inappropriate.
I said PG, keep it PG. But listen, you guys, let's be honest. You know, if you're in this perimenopause window, you're hit menopause, maybe you're in that 30s and you're starting to think, I'm getting some symptoms. Let's be honest, right? Like, I sat alone for so many months thinking, like, what's wrong with me? And I know a lot of women at home are feeling this way. So we want to just be as transparent always as possible to give you guys some answers, because I know, one, it is very expensive to get help. Two, it's hard to find a good functional practitioner that will listen to you, or even a naturopath. And three, that's what my account's for. So we're excited to do this. So this will be great.
Absolutely.
Okay, so I want to just start with this. A lot of women, I get messages on the daily, are struggling in their marriages and their relationships, especially in midlife. And I was reading, I don't know the exact statistic, but I know it's over 50% that, there's a lot of divorces happening in this age range. And not only is it, I think, because, you've got kids leaving, you've got different changes, you're starting to kind of become a different person. But hormones play a huge part, not only in women, but in men too.
Absolutely.
Men, I don't think are talked about. We just talked about that. I don't think they're talked about enough. So I know that when I was starting perimenopause, one of the biggest things I had a hard time with was, one, communication with my husband. Luckily, he's in the healthcare profession, so he understands.
And he's a sweet guy.
And he's a good guy, yes. But, so that was nice. He understood. But a lot of women are having a hard time, one, explaining to their husband what's going on with them. Husbands are feeling frustrated, right? Because they don't understand, and they're trying for the most part, you hope. And so I want to start with that. Like, let's start with, first of all, libido. What is happening in a woman's body? What are some things they can look for to know that, like, hey, I think, like, something's up? Let's start with that.
Cool. Yeah, first let's define libido.
Yes,
because that's
perfect.
where there's a lot of, I wouldn't say misconceptions, but the vernacular is different for different cultures, different groups.
Okay.
By our definition, libido is the desire or need to initiate that activity.
Okay.
Did you notice how
that was
said
good.
that?
PG.
Yeah. That is what we define libido. Now, libido is different from function.
Okay.
I've had even doctors say, well, this woman has a desire for sex, but they can't lubricate, they don't reach the end, climax.
You're doing really good.
Yeah, I am. Those are two different things. Are they related? Of course they are.
Yeah.
It's in your body.
Right.
But libido in and of itself, let's define as the desire to initiate sexual activity.
Okay.
Now, that has more variables than we have time in the day to talk about.
Right.
But in the midlife era of men and women, you hit some good ones there. You mentioned kids leaving home. That changed it. Now you got to sit and talk to your husband.
Yeah.
Right? You can't be chasing kids anymore.
Well, you don't have hobby. Like, I feel like me, I literally, I don't know what I like anymore.
Yeah.
Because I've been so involved in everything that my children are doing, right? So a lot of women are, like, struggling with that, and I think men too.
Absolutely. And that is a big part of libido, is relationships. I counsel men all the time when I see them, when they talk about libido. Let me back up. I even be very personal and open with everybody.
Okay.
My wife defined this for me at a very young age in our marriage. She goes, Warren, and I'm going to pretend I'm my wife and you're me, okay?
Okay.
She goes, Warren, I'm a crock pot, you're a microwave.
It's true, yeah.
Right?
Yeah, it's a great way to say
that's
it.
true. So I share with men, you're a microwave, dude. You get turned on like that, and you can be done like that, right?
Yeah.
30 seconds, ding!
Yes. I know.
Crockpot, libido in women, if we're talking about the relationship, is a man kissing her neck while she's standing at the kitchen sink. Taking the garbage out.
It's an emotional connection.
It's a very emotional connection that changes that desire for sex.
Right.
So that's got to be the forefront, and the first part is understanding that.
Yeah.
The relationship aspect of you and your mate is vital in treating or improving libido.
Right. And then, I feel like it's that communication too of being able to say like, hey, I need this or I need this.
Yeah.
And that's changing, right? Like,
Very
so we have that, right? And a lot of couples already are struggling with that. Let's, okay. But what do we do if our hormones now are out of whack? And what are we looking for?
Sure.
So,
from a physiological standpoint, libido involves a sympathetic nervous system. It involves a parasympathetic nervous system. It involves your hormones. It involves the sensitivity of the area, so the nervous system's involved, the immune system's involved. The physiology behind it is also very complex. But really, if we were to talk about layers, the top most important initial layer is overall hormonal health.
Okay.
Overall hormonal health.
Okay.
And that's where a lot of modern doctors and stuff make a mistake, because by definition, menopause is age 51. And by definition, it's a clinical event, which means no menstrual cycle for 12 months.
Right.
In reality, hormones change 15 years prior. We don't think of it as a hormonal adjustment. And now we're starting to. Now even if I can be so happy to emphasize, the FDA just decriminalized estrogen.
I know, finally.
Oh my gosh, you know how long I've been dealing with? 23 years I dealt with. I almost cussed. But yes.
No, it's amazing. That was like so huge.
It's so huge.
Yes.
And then the millions and millions of women that could have been treated and had a better sex life and had a better quality
to feel
of life.
better.
It's sad. So tangent over.
But we're happy.
Back to this. Yes. So overall hormone balance. And so if you're 34, 35, and your libido isn't there, and it doesn't feel as good, you're not as sensitive in that area. You have a harder time reaching the big C.
Yes.
You have a hormone issue. And that is something to address. Because there's so many hormonal disruptors. We're all very familiar with estrogen disruptors and estrogen mimickers in our plastics and the chemicals in our food and the environment. And now I just read a report, it was about 2 weeks ago, I read a report on the effect of 5G, the radio frequency on our sex lives.
Well, you think about it, you sleep with your phone next to your bed.
Wi-Fi's on in the house. You have, it's
you always have it next to you.
Continuously.
Or even putting it in your, pocket.
Absolutely, yes. Yes, so with all those hormonal disruptors, I don't care if you're 34 and your doctor says your hormones are fine according to the lab work you just had run.
Right.
You have a hormone problem.
Yeah. But that's huge right there, what you just said, right? Like, even though the labs might not show something, you still have symptoms.
Yes.
And those symptoms are something that are very important and should come way before the labs.
Absolutely. Yeah, we gotta.
We say that every video, but I want to make sure that people understand that, because I still get DMs that like, hey, my labs are normal. And I'm like, no, like that's not the only thing to look for. So, okay, sorry.
No, you're exactly right. In medicine, we're taught to treat numbers, not people.
Yeah, exactly.
Treating people is the art of medicine. We're not taught.
Right.
But the treating numbers is not a good idea.
Yeah.
Me as a physician and my fellow physicians and medical providers have to learn to listen.
Yeah.
Because I think I shared this in our last video. My preceptor at the Mayo Clinic where I did my residency, 50 plus years practicing, he told me day one, he said, Warren, if you just listen, the patient will tell you what's the matter. And then your job is to name it and treat it.
Yeah, 100%. But that's the problem, right? Women are just dismissed because they're not being listened to.
Yeah.
Which is what's so frustrating to so many of us.
Frustrating.
And I apologize, our lighting is just not going well right now, so please bear with us on that. Okay, so let's kind of back up a little bit. So you're having you start noticing your libido has changed, your hormones are off. We're going to talk about some of the other symptoms that you may be experiencing that I get a lot of DMs from. But so all of this is happening, so what do we do? Okay, obviously hormone replacement, we both
totally agree.
We have so many videos on that. So if you haven't seen those, go check them out. But what if, like, for me even, like, I got on hormone replacement and I still didn't feel like I was 100%. Like, my libido was where I wanted it to be. So what are some things women can do? And if you guys have questions too about any of this, please leave them. I'm trying to watch at the same time. But what are some things natural and maybe something they could come see a functional practitioner for? What are options if you're still like, I'm on hormone replacement, I'm still not feeling like things are getting any better?
Number one disruptor of hormones in that situation is stress.
Okay. That's
Stress.
Yeah.
Our daily constant sympathetic overdrive,
Okay.
our overuse and running out of dopamine, our happy hormone. Dopamine's a hormone that helps you concentrate, focus, and if you haven't orgasm, if I can say that word,
Well,
that's
did.
dopamine,
You did.
right?
Yeah,
We get dopamine burnout by
Yeah.
doing this.
Yeah. Well, and the cortisol, right? So like
Cortisol.
So when
Yeah,
you say
cortisol.
when you say like stress, could you say you have high cortisol? Is that kind of the same thing, or?
Well, that's a very difficult thing because cortisol can either be too high or too low and have the same symptoms.
Oh,
You can actually
interesting.
burn out.
Okay.
My friends in the naturopathic world call it adrenal fatigue,
I've
and
heard
that
that.
basically is defined as now your cortisol has been running so high so long, it's not working anymore,
Okay.
and therefore the compensatory mechanism of handling life stress is lessened.
Okay.
And if you think about it, when cortisol is activated or been burnt out, of course the system is shut down. And let me give you an analogy I like to use. Let's say it's 1,000 years ago, and me, you, my wife, your husband, we're a little tribe here in our little town in southeast Idaho that in January is freezing.
Yeah. So cold.
And Nick, your husband, if I may use his name, we're bestest of friends.
Yes,
We've been friends
yes.
for 25 years.
I know. Crazy.
Wow, yeah.
Crazy.
We had a terrible hunting and gathering season. So in January, in our little cave in Pocatello, Idaho, 1,000 years ago, we don't have much food to eat. Cortisol's high. Because
Okay.
back then, the only thing that would raise cortisol is
The fight
lack
or
of
flight,
eating or
right?
possibly the fear of being eaten by
Okay.
something, right?
Yeah.
So one of the things it does is shut off libido because the basic human instinct for high cortisol is survival. Cortisol is a survival hormone. So the last thing I'm going to do if the four of us are hungry is bring another mouth into the world.
Oh, that makes sense.
It,
Okay.
it turns off libido.
Okay.
Makes things
That's
not
interesting.
work because you can't, using this analogy, you can't bring more mouths in to feed when
you don't
you're
have
not eating.
When you have nothing to.
Yeah.
Okay.
And now we have a Maverick and a 7-Eleven and stuff on every corner.
Yeah.
But that underlying survival instinct is still present.
So many people, I mean, given, just trying to survive right now in our economy, even things like that, just like, or seeing something on social media or a relationship problem or anything like that can really just
Absolute
Kill-
trigger.
kill everything.
Kill it
Okay.
and then kill libido.
Yeah.
So it's a hormonal issue in the sense, not necessarily the hormones we think at that time, but the effect of cortisol, the effect of sympathetic tone, dopaminergic overdrive, or you've run out of it, pretty much is a way to put it. Those type of things lower libido.
Okay. So if a woman is struggling with libido, they're like, listen, I don't know what else to do. They come to you or they come to somebody else. What are some things that they can do? Like, is all hope lost? Like,
Oh, no.
okay, what can
No,
they find the libido again? That's like, okay,
Absolutely.
let's do that.
Yes, first of all is to recognize that is one of the causes. And then do the stress modifying behaviors, meditation, prayer, cold dives, sitting in a sauna, getting a massage.
So changing kind of their routine and during the day. Okay.
Absolutely, yeah.
Okay.
Understanding the role of stress, asking for help. That's what so many people are just, I'll do it. And you just,
It spirals.
you're spiraling
Yeah.
down. So the first step in treating libido is recognize the stress related and then do things for yourself to help lower it.
Okay.
Right? You can't, I like to tell you, I can't change your stress, but I can help your body and brain deal with it better.
Right.
And
right.
that's where to start.
Okay.
Make sure you're sleeping well.
Sleeping, yes, huge.
Yeah. So that's where I would start with that. The thing I'd follow with is now some of the other hormones are involved. You need optimal thyroid function for libido.
Just
to be
had a
present.
question on that.
Absolutely,
Yes,
need optimal thyroid hormone to be effective. You need not only estrogen, progesterone, testosterone. You need all the other ones: DHEA, androstenediol, all these different hormones, because that's the key word in hormone replacement is balance. not just give someone an oral estrogen pill and say, oh, you're on hormone replacement.
Right.
What about the other ones?
Yeah, we talked about that,
Yes,
right? Like,
yes, we have.
But it's crazy how many women just get one hormone.
Yeah. Oh yeah, a surgeon takes out your ovaries. What do they give you? Estrogen.
Yeah.
And you need progesterone because some of your symptoms in perimenopause are anxiety and poor sleep.
Yeah.
Progesterone.
Yeah.
Progesterone is designed. Progesterone goes to something called norepinephrine to gamma aminobutyric acid, which is the one hormone in your brain that calms you down, relaxes you, and helps you sleep.
Yeah.
So progesterone's important.
Right.
Testosterone, it's an androgen, vital for sex. Although I want to clarify, testosterone tends to get a lot of blame and credit for things sexual. In men, I would say more so. In women, not so much. If you're truly menopausal, either surgical or via the environment, or you're just that age, the FDA has approved testosterone for sexual dysfunction in menopausal women, but it's not approved for premenopausal women.
Oh, interesting.
But it's very vital in them.
Okay.
Testosterone does help with sexual function, so lubrication, reading climax, very, very important for that. But it also can help with the libido, the desire to initiate sex.
Okay.
But again, it has to be balanced. I can't just give a woman testosterone and say, "Go have fun in bed.
You got this." Yeah.
You're good."
Yeah.
No, it's such a bigger picture.
Okay.
But it does help.
Okay.
And I think there's so much fear with testosterone replacement in women because people think of the East German women's swimming team from in the 60s.
Like you're gonna be
These
manly.
big,
Yeah.
square jaw, a
Yeah.
beard.
Yeah.
The male pattern baldness and a large clitoris. I mean, all
Yes,
these things
yes.
you hear about. When you have a doctor that understands testosterone, that never happens.
Yeah.
Because that's super physiological dosing.
Yeah.
But if you dose appropriately, those things never happen.
Okay.
And so that balance of hormones is vital. And then we have to think in two terms of anatomy. You have to think of general hormone replacement, the whole body.
Okay.
So the brain's optimized, the thyroid's optimized, your gut health is good, you're sleeping well. But then we can talk about that area. Is that a good way to put it?
Yeah, that's good. You're
That
doing great.
area, right?
Yeah.
That area can change with the lack of hormones. In particular, there's a condition we call atrophic vaginitis. It's basically defined by those tissues in that area have shrunk, they've lost sensation. A lot of women, especially older women in their 60s and 70s, get treated for these chronic recurrent urinary tract infections, which is just atrophic vaginitis.
Yeah, I was going to say that's really huge in
That's huge. If you think about it, you think you have a urinary tract infection. If you're lucky, they test your urine. If you're even luckier, they culture it. And when they culture it, there's no bugs growing. It's not an infection. But they give you an antibiotic, which destroys your gut, which changes your hormones, which makes the problem worse.
It's just this like repeat
It's
cycle.
a repeat cycle.
Yeah.
So if we're talking about that area, treating that area specifically and directly with hormones, my favorite one being DHEA.
I was going to ask you about vaginal DHEA.
Vaginal DHEA will, within a week, will change those tissues. Matter of fact, my dosing schedule for vaginal DHEA, I use a 2 milligram per mil dose. I have them put on a mil at night. I have them put them in a cream that's thicker. We use something called Mucilax to make it thicker, and put it in that area every night a week for 7 days, and it's fixed.
Really?
And now to maintain it, do it 2 to 3 times a week from then on.
So for UTIs, it's fixed?
No,
or for just...
for the symptoms of UTIs, but that atrophic vaginitis, fixing those tissues down there, it fixes in a week. And then you just maintain it.
So you stay on it long term?
You stay on it, because again, but that goes back to, well, now in some women, I'll adjust their systemic whole body hormone replacement by adding or increasing their DHA. Or we'll just keep it local. And since we're on local treatments, back to libido again, oh my gosh, there's so many cool things we can do. You've heard of Scream Cream?
No.
Scream Cream?
No.
Yeah, I know. Her eyebrows went, what?
No. Where are we going with this?
Tell me more here.
You didn't know you guys were watching this, did you?
Yeah, he said Scream Cream. Gotta hear this one. So, the name's appropriate because we can put stuff like estrogen, testosterone, DHA, Viagra, capsaicin to make the area warmer. You use that, let's say, an hour before your mate comes home.
Yeah.
You're ready to go.
Oh, interesting.
Because now we've changed the tissues down there.
Okay.
And even if the relationship problems aren't fixed, which was number one.
Because that's it, yeah, I mean, that's like, we keep going. Well, you'll
very,
always
very
go back
important.
to that, right? But yeah.
The stress is still present and stuff. If you're standing around waiting for your mate to come home and you're tingly and little stuff down there, that helps libido.
True. I didn't know that was a possibility. Okay.
Oh, yeah.
Okay, tell us another thing that someone can use. We're moving on from that.
And then she's going to say,
that exists,
she's going to
okay?
turn off the camera and go, tell me more about
I
this.
think no, you're not. Oh my gosh, you're killing me. I'm just laughing because I'm like, okay, all right, let's keep going here.
And you're a little red.
I am.
You can't see in this light, but
I'm
she's
getting nervous
red.
here.
She's having a hot flash as we're talking here.
That's what it is.
Oh, okay, there you go. Well, no, because then your hormones are off.
That's right. Oh, shoot.
Yeah, you're
but
not
I'm
having a hot
seeing you
flash.
in a minute.
That's
so
right. Yes, exactly.
I'll get my hormone visit
So,
next.
Sorry about her redness. But those are just a couple of things we can do and look at in the big picture. Again, and just for people trying to take notes or listening here with you and I joking around and stuff is those relationships, understanding the role of stress, optimizing all the hormones. Like your thyroid hormone, the gut hormones, the brain hormones, and the sex hormones, very importantly. That balance there is what really works. Yeah. And works long term. Okay. Not just a quick fix.
So, in conclusion of that, I feel like you're saying there is hope because that's the biggest thing, right? Like, I feel like, I think that's where a lot of women are. They're like, is there hope? So I love hearing that there is hope. There are things you can do, but you have to find the right practitioner that's willing to listen, one, two, have lots of options. Yeah. You know, I think that's hard to do.
Oh, very hard.
So you guys, I will, after this is all over, if you comment, let's do, what's the date today? November
20th.
Let's do November, just NOV 20. I'll send you a whole email kind of wrapping everything up and how to find a functional practitioner. And I know you're telemedicine. We keep talking about that. It's going to be up and running, so you'll be able to work with Dr. Willie too. So just so you know, that will be an option. I'll make sure I post this on my page too and put that so you know the keyword. But give me a minute because it will take time. I wanted just really quick, because I feel like we did really good with libido. I think we covered that. If you guys have questions.
I got more.
You got more?
I got more.
Do you want to?
Sure, I can share with your audience that there's a lot more we can do.
Yeah.
And let's talk more procedural.
Okay,
things.
go for it.
We in our office we call it the sexual enhancement treatment with exosomes. Okay. So exosomes are placental-derived connective tissues. They're what we call mesenchymal cells derived from the placenta. Okay. And we inject those around the clitoris and in between the vagina and the urethra, that area where something called Schicken's glands are. That also rebuilds, regenerates, renews tissues.
Oh, interesting.
There's a German technique called neurotherapy that helps. It's kind of like, the way to think about it, it's a breaker switch for your nerves to your pelvis. I can turn them off and then turn them back on. And that new set of electricity using the breaker switch analogy stimulates those tissues so they're more sensitive. I use that all the time for wonderful women that have dyspareunia, which means they have painful sexual activity. Oh, okay. That fixes it.
Really?
Almost
I know a lot of women deal with that.
Oh, amazing.
So say that again, what exactly it was that you said?
It's the shot is called a Frankenhauser
That's
shot.
what I was asking. Okay.
It's a shot around the inferior hypogastric ganglia in your pelvis, and it's the best way I can describe it is a breaker switch. Turns it off, flips back on, and you have new electricity. So it treats pain, painful intercourse. It treats orgasmic dysfunction. It helps improve libido. There's a lot of stuff we can do. There's peptides, PT141, melanotan 2, all these different things we can use to help increase and optimize libido, therefore sexual function, which then in turn goes all the way back up to the top and beginning of our conversation, improves relationships.
Right. And does it matter your age? Like, can you
heck no.
use all of these?
Absolutely.
Even in menopause?
Absolutely. Okay. Yeah, absolutely. Your body may be menopausal, but there's no reason that area to be.
Yeah. Well, that's awesome, because I think that's like a lot. I mean, I didn't know. So I think that's great. Okay. Yeah.
And there's a lot more I could go on, but we'll move on, because that is a really neat topic that's really kind of taboo. A lot of people don't talk about it, including doctors. And I think it's very important.
Oh.
We in the medical profession shouldn't be embarrassed or ashamed of it. It's part of life.
Yeah.
I taught you about your bowel movements. Why can't I talk to you
I
about your
know, it's
sexual
so true, right? Well, and I think it's very taboo, but I think a lot of women are dealing with that, behind closed doors.
Yeah.
And so I think it's great that we can bring some of this to
Yeah.
light. And definitely, I mean, you can always, this is a good starting point, is what I always said. Someone just asked, they said they were seeing you in clinic and you're no longer available. They need to come to them.
Oh,
Yeah.
it's
What do you want to tell them where to find you?
so I'm not doing just pure internal medicine anymore. I'm doing 100% functional
Yeah,
medicine.
you're just in your clinic
My
now.
clinic, the metabolic clinic of Idaho.
Yeah, so you can find him here.
Yeah, I'm
and
not
find
hiding.
him. He's not hiding.
Unless I'm
He's
in
still
trouble
here.
with my wife.
No,
then
he's
I
still
hide.
here.
Not,
He's still
not
here.
right
So
now. I'm not in trouble.
You can definitely still find him. Okay, so let's do this. Because we've been on here for a little bit. Let's do a rapid fire.
Okay.
So let's play a game.
Oh, I like
I just
it.
came up with this. Okay, I like games.
I love it.
I'm gonna say a symptom that I get DMs about all the time, and we're gonna pretend that they're already on hormone replacement or not. You can give a natural
Okay.
type of relief, or if they're on hormone replacement, what's something they could be doing to help supplement.
Okay.
Okay,
That
peptide supplement, whatever you
sounds
think.
like-
Okay, ready?
Yeah, absolutely.
Okay.
Go, girl.
Brain fog.
Brain fog, a natural treatment. I love some of the racetrams, like anoracitram, piperacitram. They're available online.
What are those?
Those are chemicals actually designed by the Russian cosmonaut program that help increase brain function, for lack of
Okay.
better words.
Are they a pill?
They're pills you can
Okay.
buy. They're on over the counter. They work great.
Oh.
The second one in that area is trying an adaptogen like ashwagandha,
Yep.
maybe relora, magnolia bark, DAHB. Those all help brain fog. If you're brain foggy and you're on hormones, 10 to 1, you need to increase your dose, specifically with estrogen, but testosterone is also involved in cognitive function, especially problem solving. That's why us guys say we never need help with directions.
Yeah, because you got testosterone.
High testosterone levels, and we still get lost. But anyway, let's see, I did natural, I did hormones, and what other? Was there another one?
Is there any type of peptide?
Oh my heavens, yes.
I like to try to
my
hit all
favorite
three.
brain peptides are something like Selenk or C-Max.
Oh yeah, we talked about those.
Yep,
Yeah.
Those
Okay.
are wonderful.
And
Dihexa.
those are injectable?
You can do injectable or nasal sprays with
Nasal,
the brain
okay.
ones.
Okay.
Ceruciplin is another one. I think I said that wrong. But anyway,
You're gonna need
there's
to write all this
there's
down. I'll get it.
a number of peptides we use to optimize brain function.
Okay. Perfect. Ready?
Yes.
Fatigue.
Fatigue, that's a big one. So again, controlling cortisol is very important.
Can you give us a quick like, if I'm a woman high stressed, how would you, because I know for me, bedtime routine, what would you do for a bedtime routine with someone that's always fatigued?
Make sure
High cortisol.
Make sure you're sleeping how many hours you sleep are becoming, we're understanding it's becoming less and less important, but when you sleep is important.
Like same time every day?
Same time, go to bed, same time every day,
I
get
feel
up
like
at the
that.
same time every day.
Yeah.
Even if you're on a weekend and you like to sleep till 10, if you're weekday you get up 6, get up on 6 to Saturday and
Oh,
Sunday.
for real?
Absolutely, sleep
Wow.
timings are important. Stuff you can do right before bed, combining L-theanine, the amino acid, which increases GABA, your relaxation hormone. So having like a sleepy time tea that has L-theanine in it.
Okay.
Progesterone. If you're having trouble sleeping and you're on hormone replacement, have your doctor switch to an oral progesterone you take before bed.
Okay.
Knock you out.
Okay.
Knock you out.
What milligrams? Like, is there a...
Oh, if you're using Big Pharma and your insurance card, 100 to 200 milligrams are the common for the micronized progesterone.
Okay.
If you're having it compounded, I can do any dose I think is appropriate.
Okay.
As low as 10, as high as 500.
Okay.
So actually,
Okay.
you can go even higher.
Okay.
So progesterone is what I would say for sleeping as related to fatigue. For fatigue directly, back to the adaptogens, using an activating adaptogen like ashwagandha, rhodiola is a
Okay.
good activating
Okay.
one to help with fatigue. And then just that overall hormonal balance is so important.
Yeah.
Peptides like NAD, an oral form of NAD. NAD is an injectable peptide, either IV or sub-Q or IM. I just lost my train of thought.
NAD peptide.
Oh, yes, thank you. Yes. The other peptide I like for fatigue is some of the growth hormone releasing hexapeptides like Samorelin, CJC1295. Those help not only with fat loss and building muscle, but brain function, which in turn improves fatigue. So, yes.
That was good.
So many we can do.
That was good. Okay, let's do, we kind of talked about sleep there, so let's do anxiety, depression.
Anxiety, depression, same thing. Control cortisol, get good sleep, avoid...
There's like a reoccurring factor here. Cortisol, guys. Cortisol.
Yeah, cortisol is a big part of it. But anxiety in particular, progesterone, because as I shared that pathway, progesterone goes to norepinephrine, which goes to GABA, lowers your anxiety. But balance in the hormones is also very important for that, and depression in particular. Depression is huge in the sense that it responds to your gut. So the way you eat, when you eat, how soon before bed you eat, all these things are very vital in depression because there's so many variables behind depression. Again, we start with the balance of everything and then specifically target stuff with modalities or treatments. And that's another thing. People think we're especially in America, we're so used to, I have this symptom, take a pill.
Yeah, that's what I was about to ask you.
There's like red light therapy for depression. Amazing research on it.
Red light's amazing.
Right? Exercising under oxygen. Amazing research on depression.
Interesting.
Yeah, getting out in the sun, grounding, walking on bare feet in your grass before it snows. Around here, huge for depression. There's just so many things you can do besides take a pill.
That's what I was going to ask. So even if you have a history of depression, there's still other things you can be doing.
Absolutely. Yeah. And the medicines, I'm not discounting or saying anything
like a
bad.
need for them or whatever.
Yeah, it's okay. If you need them, that is okay. But if you're doing these other things, you get that.
It might lessen.
It lessens the need, yeah.
Okay. All right. What about, let's just do a really quick one, body odor. I know a lot of people, like for myself, that was a huge one. And all of a sudden my deodorant stopped working. And so I was like trying all these natural ones and I could not find a natural one that ever works. So what do you do for body odor? What's something that someone could do? Or do you have like a special deodorant that we need to know about?
The first thing I would do is optimize gut health with your body odor.
Okay.
Optimize gut
Interesting.
health.
Okay.
Make sure you're on a good prebiotic. I'm not a really big fan of probiotics unless they're short-term use.
Really? Why?
Because little bacteria in your guts are just like humans. You give them ultimate power, or they become ultimately corrupt. Okay. They can take over. Okay. So if you do use probiotics, rotate your brand, rotate your kind every month.
Interesting. Okay, that's a good little tidbit.
But do prebiotics daily. A spoonful of sauerkraut, a spoonful of kimchi, fermented foods.
You can't do that.
To just optimize the food the bacteria eat.
Okay.
And then the gut-related peptides like KPV, BPC 157. Those things help lower inflammation and optimize gut health as well.
Oral, right?
And
Oral.
yes,
Okay.
and then I would honestly, that in my experience, 90% of the time fixes the odor that changes.
Yeah.
Some of the odor that women experience in menopause is due to that change in hormones. So the other part of that is get back on optimal hormonal balance, and the body odor will regress.
Okay. I will say that once I got on hormone replacement, and then also like changed the way I was eating, my odor was like totally different. You
just emphasize what I said, girl.
I know,
Thank
that's
you.
great. You're
Perfect.
welcome. High five.
Yep.
All right. Someone just asked, do sun lamps really work?
Sun lamps, yes. Oh, absolutely. If you have seasonal affective disorder or SAD, sun lamps are amazing for it. I have a huge sun lamp in my office at my house because around here this time of year, we come to work when it's dark and we go home when it's dark.
Yeah.
And if I don't sit in front of my sun lamp for a half hour, an hour a night, I'm depressed.
Really?
Oh, totally. I have terrible seasonal affective disorder.
So sun lamps are great. That'd be a good Christmas present, you guys.
Yes,
I love it.
very much so.
Okay, let's just do two more.
Sure.
Hair thinning.
Oh, another one with lots of variables. Optimize the hormones. Thyroid, in particular, gets a lot of credit and blame, but not always the cause. Estrogen's vital for good hair loss. Okay. If you're on something like tirzepatide or semaglutide or any of the GLP-1s, those can cause hair loss. Okay. The high stress causes hair loss, so fixing stress will help. There's procedural stuff like using exosomes or placental-derived connective tissue actually injected into the scalp to regenerate hair growth. Works amazing.
Really?
I can show you some unbelievable before and after pictures of those.
Do most functional practitioners do that?
No, unfortunately not.
Yeah, because who do you find that would... but
Yeah, that would be just calling around and asking what type of hair treatments do they do.
Okay.
And find out.
Okay.
I mean, there's oral treatments like oral minoxidil, which works really well. There's a lot of stuff we can do for hair thinning. But again, and we emphasize this to the point where we're bright red, not only from embarrassment, by saying it so many times, balance.
Yeah.
Getting that balance.
Getting balance.
Because the most common cause of hair loss is called telogen effluvium, which means the cycle of hair growth stops. And so you have more hair loss than growth, and that's what you get out of your shower over the drain every morning.
Okay.
You have to change that telogen effluvium, and you do that by what we just described.
Okay. What about peptides like GHKCU? Is that a good one for hair?
That's a wonderful one for hair,
and
both
skin.
Locally and injectable.
Okay.
Yeah.
Okay.
It's a copper peptide.
Yeah.
The biggest thing about that a lot of practitioners, included, don't understand and know is you have to have a balance between zinc and copper in your body.
Oh,
so if you're on an injectable copper peptide like GHKCU, I would never do it more than 6 weeks straight, and then take at least 2, maybe 3 months off before you do it again, and have your doctor run a zinc to copper ratio, which should be 1 to 1.
Okay.
If it's not, then if you're taking copper peptides, take zinc with it.
Interesting. I did not know that.
And that will even help the hair growth and the skin stuff more so.
Okay, that's interesting. I'm learning a lot here.
There you go.
Okay, someone just asked about the sun lamp. Do you have certain things for them to look for to get a sun lamp? Is there certain things I don't know.
Oh, yeah. Forgive me. I can't recall I'm trying to think of the name brand on the one in my office. It's a full spectrum sun lamp, so you literally get a tan under it if you stay there too long.
Oh, for real?
Yeah.
Wow.
So tanning beds are another thing that seem to be criminalized by the dermatology world, but they are very helpful in the winter for people that have seasonal affective disorder.
Interesting.
So it's that full spectrum UVA, UVB light in a sun lamp is something I would look for.
Okay.
And forgive me if I can picture the name of the company that makes mine, I'll say it before we get off.
Okay, perfect. Okay, last one. Itchy ears, skin, dryness. What would you do? What can someone do?
Well, first of all, realize the environment. Like, we live in a mountain desert.
Yeah.
And so
we're
it's
always dry. Yeah.
So one of my first line approaches, guess what? Hormones.
I know.
Estrogen in particular.
Right?
Estrogen in particular. But also using like high dose omega-3, omega-6, omega-7, 9, and 11 fatty acids. So fish oil tablets. And don't be afraid of them. Take 10 a day.
Yeah, because you need a lot, right? I just realized that the other day how much, I don't think I'm getting enough.
Yeah, and there's a test we can do. It's called the Omega Index, or red blood cell Omega Index. And you need to be at least 8% with that, and you will not have dry skin. Crazy. And if your skin's not dry, 99% of the time it's not going to be itchy either.
Huh, okay. And what are and this is totally off subject, but with the omega-3s, isn't there a lot of research with cancers and things like that, having enough? Am I wrong?
No, you're exactly right. The omega-6s in and by itself are the your fries from McDonald's are made of omega-6s, right?
Oh, okay.
So that's
you don't want that, right?
cancerous. So the balance between the fatty acids is what is preventative.
Okay. Cool.
So good companies like that, because here's the problem with fish oil. Studies have shown that a lot of the stuff you buy in your grocery store, it's rancid.
Yeah, I've heard that.
Yeah, so I trust 2 companies, Nordic Naturals, and I'm not getting paid by these guys. I'm just telling you because I want
Nordic
you to
Naturals.
Nordic Naturals and Thorne Research.
Thorne, I've heard of.
Thorne, both of those carry a quality fish oil, krill oil. They're the ones I would buy it from, so you're not getting something rancid.
And so if you're having that dry, itchy skin, that's great.
Absolutely.
Okay. This is super helpful. I learned a lot. I hope you guys did. I'm going to probably have to write down half of what you said because I don't even know how to spell it, but I will write it down. If you guys comment NOV20, is that what we said yesterday?
That's it, yeah.
NOV20, give me a minute. I'm going to run home, get all the notes, and then I'll send you guys all this information as well. But we're going to hopefully start doing more regular lives.
Yeah,
and
I hope we do.
Yes.
There's so much we can talk about. It's so much fun.
So much, yes. And we always just love your expertise. So thank you so much.
Yes.
He's still working on getting his telehealth medicine stuff all set up. But we promise, because I keep getting messages, but I promise that, I'll let you guys know as soon as that's set up and where you can find Dr. Willie. But appreciate you guys hanging out. And if you have anything you want us to touch on, go ahead. I'm going to post this on my main page, and you can just go ahead and comment what you want us to talk about next.
I love that idea. If I can interject, if you wonderful people have a topic you want us to discuss, let us know.
Yeah, we would love to.
I love getting quizzed out of nowhere. And
Yeah.
so it's just there's so much stuff that's so misunderstood, and there's so many experts out there.
It's exhausting.
It's exhausting.
For someone like myself who's a consumer, it's exhausting, and then you're like, okay, I'm just going to do nothing because
Which affects your stress, ruins your sex
we've
life,
learned about
and gets you a
cortisol.
divorce.
Yeah, so we've got to work on our cortisol. That's the big one, right?
Yes.
I love it. Okay, well, thanks you guys, and thank you, Dr. Willie.
You're my pleasure.
And we'll see you guys soon.
Bye-bye.
Bye.